Hello again, everyone. Mark Macomb, Macomb County Executive. John Paul Rea, our Deputy Executive, giving you the updates of what's going on here in Macomb County. And again, as we always do, we try to update you on the number of cases that we've got here in the county and, unfortunately, the number of deaths related to this COVID virus. John Paul, where are we at with our numbers today?
Mark, the numbers continue to increase. Today, this morning here in Macomb County, our community dashboard has confirmed 2,066 cases countywide, and we are at 83 deaths. The other thing to keep in mind, too, statewide, 15,718 cases, 617 deaths. The state also has confirmed this morning, just from the governor's briefing, that more than 80% of those cases are still concentrated in southeast Michigan.
Yeah, Detroit hardest hit. I mean, there's no question about it. We're seeing that, that movement throughout the state. In fact, every county in the state now has a reported COVID case, somebody testing positive, as well as some of them death related, even in the Upper Peninsula. So it's a sad reality what we're seeing. But it's again, we haven't even hit that peak. It's coming.
Mark, we're very much still on the upward trajectory on that peak and on that curve. Obviously, everyone talking about the social distancing standards that are still in place. The president coming out with those recommendations from the CDC out to the end of April. Governor again said this morning she's looking at possibly extending the stay-at-home order. It goes back to the personal responsibility. It's going to not only help ensure that those cases don't surge to the point of where we're going to strain capacity at the hospitals, but more importantly, ensure that we're taking care of our friends and loved ones.
You know what I find interesting is sometimes people are wondering, okay, so we have in Macomb County 2,066 cases, from the onset when this first took place. And just a reminder for folks, and you stop and you think about it, when the first case hit the United States, Washington State, January 21st.
Correct.
Was when that very first case hit the United States, and the question was, we've heard about what's happening overseas. Is it finally here? There was some hesitation as to whether or not that was going to have an impact, but then comes March 10th for Michigan, and the first two cases we established here were both on March 10th, and that was in Wayne, one and one in Oakland County.
Same day, correct.
But a multitude of cases were happening around the country at that same time. So here in Michigan, we got hit with our first reported cases on the 10th of March, and in Macomb County shortly thereafter, we had our first case on the 13th. And again, now we're up to 2,066. The question or concern I get from a lot of people, and I think is still out there, is to, okay, although the numbers are 2,066 of people that have contracted this, they don't still have it. Some people have, gotten past this, they've gone through it, much like a flu or other virus. And how are we tracking who comes, off of that list or who no longer has it has been the big challenge. And I think, the CDC has been trying to figure out how do we deal with this and, make a determination, but there has been no standard way of, identifying that and putting a number to it. We don't know.
Yeah, Mark, unfortunately, there's really no standard data point with regards to recoveries. However, as we're able to celebrate this weekend, not only through macombgov.org, but a number of social media channels, those hospital systems which are trying to put together some type of recognition for the doctors and the nurses and the entire personnel there that are helping people recover and actually heading home after they do contract the disease.
And interesting, they're putting those dashboards up within their own lobbies, and I think that's kind of for comfort for the people that are working, and again, incredible people. These are truly, my 30 years in law enforcement, the true heroes right now during this crisis are the people that are working in the healthcare system, the doctors, the nurses. I mean, it's incredible work that they're doing, and you got to imagine it's somewhat taxing on them, having to go in and day out, seeing people coming in and the continued increase in caseload, but people that are on respirators and not being able to have their loved ones come in and visit them. It's got to be very emotional, very trying. And so with that, they put up these dashboards to give them an understanding of how many people have successfully coming off those respirators. And some people that, they believe now are past that, testing positive and no longer have the COVID virus inside them or within them. So it's good to see that they're doing that because it gives them a sense of purpose, why they're doing what they're doing.
And Mark, it's even interesting whether you're watching the president's briefing, whether you're seeing things coming out from different governors across the country, whether Governor Whitmer or Governor Cuomo, talking about the whole notion of how we will persevere, what the recovery looks like, how we're going to be able to respond not only to the virus, but as you've been highlighting to the whole notion as far as the economic recovery. What are we going to do long term? How is it we can continue to support those small businesses and ensure that there are outlets from everything from unemployment to community services, and all those resources are available at macombgov.org.
And it's the aftermath. We got to start preparing ourselves for understanding exactly where we headed as a country. So, not just as a country, but even as a county, with the incredible amount of people that have now applied for unemployment. the issues with businesses that are very much challenged right now financially as a result of what's happening here. So, this is going to have long-term impact. Even municipalities, county government with the budget is going to be a problem moving forward. Those are secondary to the health concerns that we're seeing right now. So we need to figure out how do we continue to put that front and center and make sure people are abiding to the stay home, stay safe, and save lives order, and some of the others that are coming. So the governor's trying to get a hold of it. Even listening to President Trump, I continuously try to pay attention to what's going on at the national level. We stay in contact with what's going on with the governor on a daily basis. But when you start looking at the president of the United States, even saying the same thing, he's being pressured to do the stay-home order for the entire country. He hasn't quite got to that point, but now he's saying, you know what, he's a believer in even people, wearing the mask, that personal responsibility, not so much the N95 mask, but even some kind of a face covering if and when you're out in public. If you have to go out in public, you should shield yourself with some type of a mask. And again, sometimes they're lower grade, but from what we're hearing from everybody from the CDC and even our health department, it still will probably make a difference. It was kind of refreshing to hear even the president saying you need to do this, be part of the solution, because we've got to figure out how do we contain this and flatten that curve. Because boy, I tell you, these hospital systems, even here in Macomb County right now and around this region, are getting inundated with the patients coming in.
It's been interesting on the mask front, Mark, how you see a lot of that community connectivity, whether it's a local sewing group or whether it's a community agency that's trying to, whether it's source some type of material or give people templates of how they can use their own sewing machines at homes and everything, or even the makeshift bandana and everything. That's another one of those things where people are adding a little bit of style and flair to it to show, hey, we want to protect our families.
Yeah, and to be honest with you, I went online and tried to figure out how do I get one. My wife is making one for me in the meantime, but I think it's going to be somewhat, it's without question the right thing to do, but sometimes people say, geez, I really don't want to wear it, it doesn't look fashionable. Well, I think you're going to find they're fashionable ones. They're there, so I guess to use the old Nike slogan, just do it. I mean, do it on behalf of your neighbors, on behalf of the community, be part of the solution. So, that being said, I think you're going to find more people doing just that. In fact, I go out and about, and I'm going to tell you, whether I'm walking the trails or at a grocery store, I do find more and more people are wearing some type of a mask, not only for their own protection, but to protect others, because there are some people that don't even realize it, but they may have this virus within them. And they're possibly carriers or spreaders, and they don't realize it. So if for no other reason, try to figure out maybe how do you help others by containing this by wearing some type of a mask.
Mark, I think the other thing that's been interesting too is folks have been going to the store lately, is whether it's the local grocery stores putting up some type of shields or barriers in between customers and employees. Again, it's that personal responsibility, that social distancing, and making sure we're taking those extra precaution steps so we can stop the spread as much as possible.
Yeah, and so again, it's a voluntary, it's not a mandatory requirement on behalf of the state and or the federal government, but one I think we need to heed those warnings and try to take on that personal responsibility we can. And getting back to what we're going to be doing moving forward for the businesses and people that are in need because they're on unemployment, we're continuing to process information coming from the federal level as well as the state. More information is available on macombgov.org, and we're hoping people tune into that, find out exactly what they can do to help protect themselves, be versed on the numbers that are happening in and around this area, but more importantly, try to keep themselves safe as well.
Yeah, Mark, the Small Business Relief Program, we've had thousands of businesses over the past week that have come in to get the information. Our team is reviewing the applications, and we hope to be getting some awards out there shortly. And as you also highlighted too, the whole notion with regards to unemployment. We're working with Michigan Works. Michigan Works is engaging the state of Michigan in that side with the labor and economic opportunity, and we're developing so many different inventive ways to engage people to that resource right now in these times.
Yeah, and again, on a final note, I just want to remind everybody we do this on a regular basis too. The census count, very important. Census 2020, help bring back our money. You've got that census information or that request for you to fill it out. It's on your table or somewhere at home. Fill it out, turn it in. It's important for us to get money back here to Macomb County. So with that being said, we want to thank you for joining us for this quick update. We hope to continue to update you as we move along. But on behalf of John Paul and myself, stay safe. And again, thank you for being part of the solution.
Thank you.